Nature lovers have long appreciated that getting outdoors feels good, whether walking, biking, or just soaking up the scenery. Now, there's undeniable evidence that getting out into the great outdoors is actually good for your health in more ways than one.
What we found is that consistently over a whole slew of different kinds of measures, that the more you're exposed to nature, the better your health is. And more importantly, the less you're exposed to nature, the worse your health is. You can be sitting, you can be outside reading, you could be outside playing soccer, you could be any of a number of activities, just spending time outside with friends and family at a picnic bench. Even those kinds of activities have clear benefits.
The Healthy Parks, Healthy People concept is integral to Metro Vancouver's regional park strategy.
There's an absolute plethora of research which has been royally ignored in the healthcare circles that are more conventional, but is very, very powerful and really inescapable in its conclusion. We should be outdoors more.
That'd be great. Let's go this way, guys.
You won't get any argument from Liz Burse, a Metro Vancouver staffer who swears that the simple act of a daily walk literally saved her life while battling an aggressive form of breast cancer.
I had always had to get some fresh air after, sitting, having chemo for, maybe 4 hours. I had a walk that I would do that was really when I was feeling well, a 4-kilometer loop. But on the first day out, I could make it maybe 100 yards to the first park bench. Get to that park bench, it was my goal. I'd go and sit there and hang out and watch the birds and, watch the water. And it was just so beautiful and relaxing. And then I would retreat and go home. And then, a couple days later, I'd be able to go, to the next milestone. And then by the time the 3 weeks was up, I was able to just boot it right the way around the 4 kilometers, and I would feel great. It just made me feel better, plain and simple.
That was 7 years ago.
It is keeping me well, because when I go and see my oncologist now, he said, "What are you doing? I've got to interview you sometime to find out what it is that you do that keeps your, your pulse of that of an athlete, and just keeps you so well and happy." And I just know that a lot of it is being outside, just getting out. Absolutely, no question. Look at this over here.
Liz's story is compelling, but it turns out that even looking at nature has positive benefits too.
One of the interesting findings is people who are recovering from surgery in either a hospital room that has a view of a brick wall or has a view of just a little park area. And the people who have the green view are getting out of the hospital sooner, taking fewer and milder painkillers. The outcomes that have been associated with even very small differences in access to nature, such as a view versus not, they're really impressive.
When it comes to children, the experts believe that getting kids outside will pay off immediately, as well as down the road when fewer health problems develop.
It doesn't take much of a stretch to give kids the opportunity to spend time outdoors. It's us as adults who have failed to create the spaces for kids to be outdoors. We've simply structured the world to make the outdoors seem difficult to access, hard to get to, not always hospitable. We've given much of our outdoor space over to the automobile, and as a result, kids think, well, that's normal, and they simply follow along and do it. They may not do what their parents say, but they tend to do what society says.
We now know that nature generally relieves chronic stress. So just by looking at it, by being in it, by engaging with it, it actually relieves the stress. And stress has now been thought to be one of the key aspects for most conditions of Western society. So obesity, diabetes, dementia, depression, they've all got a connection to chronic stress.
The experts believe it's necessary to shift our healthcare spending away from focusing on treatment and onto preventing disease in the first place.
I see that the percentage of budgets dedicated to preventative health is going up. I think that's a really good sign. And so the nature industry, the parks industry have got to be smart about, okay, how do we work with the health industry to work on this whole preventative health wave that's going around the world?
One answer lies in forging a better connection between the health industry and the various levels of government that plan, design, and operate public park space.
Here we have two sectors that for many people seem miles apart. Health has nothing to do with regional parks for some people. Health is hospitals and doctors and stethoscopes and health professionals. Whereas there is actually a lot that health can do to achieve its goals by working with people in parks, but just working at the government level isn't going to achieve it. We're talking about getting people into those parks, cultivating healthy living, cultivating healthy lifestyles, having people engaged and recognising there are all sorts of connections between health and nature they can make in their lives.
If we can get people outdoors and become more active, then we know that we're going to get health benefits without any doubt whatsoever. There's no question about it.